You're with Andi Lew, and this is the Well-to-Do podcast. Remember, it's all about creating abundance on a wellness level in your life. And I'm welcoming our guests who's also revolutionising the field of dentistry. What's so interesting about Dr. Sara, welcome.
Thank you. Thank you for having me.
What's so interesting about you is that you're actually redefining the way dentistry practices. And I came into your clinic, which is the Comfy Dental Studio in Beverly Hills. Now, when I came in there, I realized that it's really about making the patient comfortable. So that's what's important. And also non-invasive natural techniques, which is what we're all about on the Well-to-Do podcast. So congratulations for, starting something that's, I guess you're a pioneer in the profession.
Thank you so much. Thank you. Yes, that's absolutely right.
What was it behind the ethos or the philosophy of feeling comfortable? I mean, if you think about it, most people don't think that dentists or going to the dentist is a comfortable experience. So is that where that stemmed from?
That is exactly where it stemmed from. That is the idea behind making people comfortable, but that is not the whole story.
Right.
The whole story starts from when you step foot into the office.
I see. So what's so scary about stepping foot into a dentist office? I know that you had a very open plan feel. Was there some method to the madness on that?
There is. I'm actually trademarking it, and it's called the Comfy Method. Mm-hmm. The Comfy Method starts from the minute you stand in the office and you enter the office, you feel it. It's a multi-sensory experience. You feel it in your sight, what you see, the way you feel, what you smell, the way all the auditory visuals, everything's rounded. So it is one with nature.
Yeah.
We have all these wave type movements in the office, in the architecture, in the furniture, in the pillows that we use. So it starts from there.
That's so true. I mean, you call it the new wave of wellness. So is that what you mean? I think there's a pun in that, as you say, the interior design, the decorating. I noticed the open plan. I found that very interesting. When I owned my own wellness practice in Australia for 11 years, we had a different kind of a setup where we collected payments, and it was a stand-up desk, and it was also a bit sort of, off to the side and not right in the middle where there's that barrier. Tell me, was there some, I guess philosophy behind that as well?
When the patient steps into the practice, I want them to feel like they're in a lounge. There's somewhere they can relax.
Yes.
So that's how we set up the office. We don't have a front desk. You don't enter into a place where you have to answer to someone. Mm-hmm. You are greeted, you're welcomed in. We give you wellness drinks. We let you smell the aromatherapy. You look at all the sites, and everything, like you said, it's called the new wave for a reason, because everything looks like a wave. It's one with nature. It's harmonizing. It's very comfortable. So you don't feel like you're in a harsh environment. That's the idea.
So hence the comfy method. This is something that is, I guess, separate to the actual studio, which is the first one of its kind. I mean, you invented this, and your degree stemmed from having, seen you learned in Harvard online schooling, and you could see the way dentistry was taught, and you noticed that there was something missing from that, and this was it, right? So tell us more about your qualifications.
That's correct. Actually, I think the way I was taught dentistry, I graduated UCLA. The way I was taught dentistry, I was actually thinking about this morning, is that we learned so much about the whole body. I learned so much about the heart when I was going through my graduate studies. Mm-hmm. And my husband's a physician, and when I brought it to him and I had questions, he was asking me, "You're a dentist, why are you guys learning about all of these things?" So a lot of places, a lot of institutions actually do teach you the whole body, but not everybody takes that away from it. Mm-hmm. So what I did was that I brought this, and then I took the online courses for extra nutrition courses, and I learned about the lifestyle methods for whole body health and prevention and longevity. So I brought that concept into dentistry.
I mean, that is very crucial because this is holistic health, and that's the way health should be practiced, right? So we're not just about that mechanistic model where it's just the mouth. The mouth is connected to the gut and so on and so forth. But you really take everything into consideration, including the mind. So as you say, the nutrition was important. I enjoyed that rose water that really made me feel not only comfortable, but inspired. And then I must say that, part of the most enjoyable experience of being at your practice, and not the only one, but was the vibroacoustic bed. And that's something really so special that almost can't be described. I actually felt like I was in the womb. So the sound that matches, the movement of the bed mimicked, I guess, like the heartbeats in the womb. And it really almost put me to sleep.
Yes, exactly. So think about it. Like you said, when you think of a dental office, the first thing that comes to mind is anxiety, right? And that is the part of lifestyle practice that I wanted to first and foremost implement in the practice to help people overcome that feeling and kind of change the whole outlook on dentistry, right? Demystify what it feels like being at the dentist and what it feels like to be seeking oral health. It's not about anxiety. It's not about pain. We want you to feel comfortable. We want you to feel at ease with yourself. So we brought in the vibroacoustic bed as part of the lifestyle practices to help you meditate. I've had people put on Fitbits and their blood pressure's lower when they get off. I've had people, we took their blood pressure and we took their heart rate and we could see a stark difference. I've had people not be able to get numb when they skip the bed. It's optional, obviously.
Wow.
And when they actually do the meditation, they get numb, they're comfortable, their whole experience changes. So that has been crucial in implementing the lifestyle methods and the comfy method in the practice.
You even had someone, I came to one of your events because you're all about community, but you had someone forget where he parked the car. That's how relaxed he was.
Yes. So people do have different experiences on that bed. Like you said, somebody forgot where they parked their car. Even this morning, I had a young man come in. He had been up all night, very young. He was working. And he came in, he said, I just really needed this reset. He sat there and he got up. He's like, this is all I needed. I needed this reset. I forgot where I was. This is amazing.
And it's not just all you do is reset our nervous systems and prepare us for, it's not just a screening, but it's an examination that's so thorough. You also prepare us for anything we need. And one of the things that I guess you're well known for is what's called the power washing. Tell us about why that's so good. I'm just a fan of the fact that there's no bleach involved.
So the whole practice is, like you said, based upon patients' comfort. At the same time, we're looking at the body as an entirety, and we want to be a non-invasive, holistic practice with state-of-the-art technology. The new technology in dentistry is really helping take us where we need to go.
Yeah.
We brought this technology in. It's a protocol from Switzerland. It power washes your teeth with water and a soft powder which has sugar alcohol. The sugar alcohol is a natural substance that it starves the bad bacteria. So that's the one benefit to it.
Okay.
The second one is that it's very thorough because it's water, so it can get in all the little spots that mechanically we can't get to. Third thing is that it's non-invasive. We don't have to scrape your teeth. We don't have to polish it with abrasive paste. And the byproduct, which is great, is that it whitens your teeth because think about it, it gets in the pores and it takes all the stains out.
Yeah.
Now that all the stain is out, your teeth look whiter.
And they
but
sure
naturally.
Did. I did it. It was like, 3 or 4 shades lighter.
Yeah.
This was in the chair. It really was comfortable. There was no scraping. And, I came away with a result half an hour later, which was fantastic. And, people think that they can do that at home. But then, of course, they're also using, bleach and things like that.
Yeah,
so
that's true.
I think that is absolutely revolutionary. I mean, if you think about how many people don't do teeth whitening just because they don't want, some of these toxic, products. Now we've given them a way where they can still have a great aesthetic look and be healthy at the same time. So this is really leading the way. As I said, you're a bit of a pioneer in the profession. And I heard you say at, the launch of the Comfy method in Gravitas in Beverly Hills, which is a private club for people who are really changing the game in lots of different areas. And I heard you say to some of the other doctors who all support what you're doing, these holistic medical doctors and so forth, you said to them, listen, when, people come to my practice and they're filling out a patient questionnaire, the first thing you do when you care for someone is like, when was the last time you saw a doctor? Because you want to look after them holistically, make sure there's sort of no pathology as you're going into the mouth. But you suggested, how about doctors asking when was the last time they went to the dentist? That is just it's a no-brainer and it's insightful.
And did you see the both of them were so surprised that it's very simple, but it's never been done?
I saw the reaction and I must say, I read into that as you mean I have to refer you people?
No, I think it's because they think it.
Yeah.
And they know it's important. Mm-hmm. And everybody admits that in medical school, you don't learn much about the oral aspect of your health. But they somehow forget to ask people, when was the last time? We do get a lot of referrals from doctors, to be quite honest.
Great.
Sometimes the problem is, most of the times we get referrals when they have to go into surgeries and they need a dental release.
Right.
Or if there is a problem.
Right.
We're seeking to have them come to us before the problem arises.
Right.
We want them to come in as a prevention, because if you're looking into longevity, if you're looking into wellness, your mouth is the gateway to your whole gut microbiome. Basically.
And a lot of people listening or watching don't even know this. This is true prevention. So this is about being proactive, not reactive. And we're not used to that in the medical model necessarily. So it is a surprise for them. But even just planting the seed for the patient to be having to fill out that box, it plants the seed. If the doctor even doesn't get time to say it, now they've had that opened up experience to thinking about, well, you're right. Have I been looking after my mouth? There's so many things, including we've touched on, I guess, aesthetics. That's just, tipping or scraping the surface. No, pardon the pun, because you don't do any scraping. But now we're talking about microbiome. What is the connection? Let's really deep dive into how the mouth affects the gut and how the gut is affecting the mouth.
So I'm going to say one thing in aesthetics. I'm going to say that what's really important is that aesthetics can be holistic too, right? So that's where we're getting to. You can have a beautiful, white, bright smile, but it can be natural.
Amen.
Right? We can work with your body, allow your body to heal itself, or what we put in your mouth to get it to where you want it to go can be very bio-friendly. So that's that. And then your next question about the connection between the microbiome. So as was mentioned in the event you talked about, the whole digestive tract starts from the mouth. So whatever you put in your mouth goes through your whole digestive tract. It obviously goes to your gut. It does go through a lot of processing. So it does go through the stomach and the acids. A lot of the bacteria do not pass that stage, but a lot do, right? And a lot of the things that you put in your body or in your mouth can get into your gut, and it can unbalance what you do have there. Having said that, your mouth also is a host to a lot of bacteria. And that bacteria, if we don't control the balance of it, that can also get into your gut, not just the food you eat. The food you eat is one part. So if you have any kind of imbalance in your oral microbiome, it can directly affect your gut. There are a lot of studies now that prove that there's a connection between dementia and periodontal disease, which is gum disease, right? So that's the blood-brain barrier. You see that the microbiome or the bacteria in the mouth can pass the blood-brain barrier. The other problems is high blood pressure.
So the blood-brain barrier is what is going to, I mean, if that's out of balance, that's causing the dementia potentially. Is that what you're saying?
Yes. So they found a correlation. It's not necessarily a causation, but they found the correlation between it. And that was one of the most important findings. And they keep revisiting that study and finding more information. And it's now very well known. The public knows that.
Oh.
Another thing I just recently read for women is that a lot of women that do have migraine problems could have issues with their gums.
I see.
So they could have gum infection.
And gum recession comes from, people say it's hormones, but then you can connect that to stress as well. So
exactly. So that's another aspect of it. So gum issues or gum and bone issues, there's a whole apparatus there, right? They can come from different, they have different aspects to them. It's not just one problem that causes it.
It's always multifactorial.
It's multifactorial. So we're talking about one factor, which was the bacterial.
Yep.
The hormones are a different issue. You do get gum recession from hormones, but you would have to, that's where the connection with your healthcare provider, meaning your medical doctor, and your oral care provider comes into play, where we work together just to make sure we have everything in balance.
That co-management is really so important. That's why I was so impressed that you have so much advocacy from and testimonials from other health professionals in what you're doing with teaching the comfy method and putting it into other practices. And you've only just launched and already, gaining the attention of all of these incredible health practices and people. It's really amazing that, and if you think about how incredible your profession is, that when you look inside the mouth, you can go, I see hormonal issues. I see potential dementia. I see, something going on with your gut. You even can see if somebody has bruxism. Tell us about, there's a large percentage of people who have bruxism, which is teeth clenching or grinding, and you can tell just by looking at the teeth.
You can tell, exactly. You can tell by looking at their x-rays. You can tell by looking inside their mouth. You can see the wear facets. You can see the way their tongue is shaped, if it's scalloped, if they're pushing their tongue against their teeth, if their teeth are flared out. There are a lot of symptoms that you look at to see if someone is actually going through bruxism. Another thing that is correlated to bruxism is sleep apnea. So everything is really connected.
Wow. I mean, I brought this to show people that might be watching, and this is a really unsexy thing that I've been wearing. It's my night guard. It even is not even clear anymore, and this gets made by a dentist and this is on the bottom. So imagine wearing that next to a partner before you go to sleep. The thing is, this actually helps for anyone who doesn't understand, who might have bruxism and wakes up with headaches. Making something like this with your dentist can help the TMJ band from, going into spasm. But it's not necessarily addressing the root cause. It's not a great long-term solution. What are some of the things that could be done to, help with bruxism? I know firsthand that, and also professionally, that when I have done a parasite cleanse, it does improve. What are some of the other things that you think are responsible for it, and how can we improve bruxism?
So bruxism has, again, multifactorial, big part of it is subconscious. What we do recommend is we go through a home protocol. There's a whole protocol of what to do and what not to do, but a lot of it is symptom management. Like you said, a night guard is great. It's mostly symptom management, and it's preventative to prevent any kind of loss of tissue, right? But there are a lot of things we can do. We can do dental acupuncture, photobiomodulation. There are exercises that we recommend that if you do, it's going to help you replace the habit, because when something is subconscious, it becomes your habit.
Interesting.
And we replace that habit with another habit that is actually good for your jaw and your teeth and your whole mouth.
So what you're saying is, like when we say never wake a sleeping baby because sleep begets sleep, right? And so the same thing goes with, the body's used to being in this habit. And so when it's done, it's just done. And so if we create new habits, we're resetting the nervous system perhaps. And I guess that's what you're doing with the comfy method, and just having people experience a comfortable, step into a dentist practice. You're resetting and rethinking, redesigning how we see dentistry. In the past, we've associated the certain noises of the scraping or the machinery that's being used as something as bad. But when we set up that, immediate feeling of relaxation or comfy feeling, we start to change the way we perceive some of those noises, right? So you're saying with the bruxism and all that sort of thing, that's just symptom management. But how about we go more holistic and even deeper and just reset with a whole bunch of things? Now, you even said it could be something to do with, I guess the occlusion and wanting to reset that. The body subconsciously maybe wants balance. I know we always seek balance, and then you suggested Invisalign. So you work with a lot of other people, right?
I do work with a lot of other people, but I do provide the Invisalign and the ortho effects that I work with, which is a nighttime wear. I do provide all of that myself, but we do collaborate with orthodontists and again, the dental acupuncture, the photobiomodulation, all of those we do ourselves.
Interesting.
Acupuncture is not a new concept, but implementing into dentistry is. Photobiomodulation is amazing. And I feel so lucky to be living in these times where you get to use all this technology.
Yeah, you have so much access.
That helps you provide the care you want to your patients. For example, we can do our fillings. You talked about the noise that bothers you, right, when you step into a dental office. So we can use a laser to eliminate that noise and do fillings without having to do anesthesia.
So there's no buzzing when you're using
There's no buzzing.
See, I didn't know that because I haven't had a filling with you yet.
Yeah.
That's really cool.
Yeah.
I mean, we talk about noise or music and that vibrational frequency and how that can help. You have frequency healing when played at certain hertz and things like that. I honestly had a thought about this driving to the car. Imagine if you did the whole procedure on a vibroacoustic bed. I mean, is that even possible? Really just programming our nervous system. I mean, probably the patient would fall asleep and then you wouldn't be able to get into their mouth. Is that right?
That's one thing. And then practically it's going to be hard because you need the patient at a certain level and you need to be able to put them back and forth, and you need the light. So if we come up with a dental chair that does that. To be quite honest with you, when I was starting to set up the practice, I was looking for a dental chair that also does massages.
You're going to have to design one.
Yes, exactly. So if we can come up with something that does that for you
right
at the same time, I think that could be a game changer. At the same time, you're right. I don't know if I want my patient to not be responsive to me. I want them to be engaged in what we're doing and actually not dread it.
Yeah, right.
That's the idea.
Yeah, that's true. That's very true. So this is all, wonderful, and your thought processes behind constantly making sure that the patient is with you, that the patient is engaged, that they're feeling comfy and all those things. So tell us about your wish for the world on, where a comfy method is going to go, and how can we all keep in contact with you?
The idea is that the comfy method should be in every dental practice, to be quite honest. That's going into the future. But from here on, I envision having the practice franchised in different locations for better access for everybody else that's interested in it.
Amazing.
But currently, we are at our Beverly Hills studio. Do you need the address?
Yeah, well, otherwise, should we have the web address? Let's all find you.
Yes, so the web address is www.comfydentalstudios.com. And we are on the corner of Wilshire and Linden on Wilshire Boulevard in Beverly Hills, 9730 Wilshire Boulevard. We're in Suite 109.
Oh, I love number 9. It's my favorite. So 109, guys. But Comfy is spelled COMFY, Comfy Dental Studios. You're also on Instagram, so we'll slide into your DMs and ask all the questions and stay abreast of any more events that you've got coming up. You do a lot of those. So thank you so much for sharing your philosophy on dentistry and feeling comfy. That's Dr. Sara from Comfy Dental Studios. You're watching Well To Do, and share this with everyone you know.